Hello everybody. Thanks very much for the opportunity to come and speak to you all today. As you can see, my name is Patricia McCrory. I'm Northern Ireland contact point for health for Horizon 2020, and part of that role is to disseminate the funding opportunities to the wider stakeholder community in Northern Ireland. So I don't know how familiar any of you are with Horizon 2020, but it's an €80 billion fund for research and innovation activities, a fund from the European Union, which is cascaded to stakeholders across Europe via this schematic. So there are the three main pillars of funding. We have excellent science, which is for funding for individuals, to promote innovation and excellence of people in Europe. And obviously then the aim of that is that excellence brings around greater research and innovations reaching the community for market development, etc. Then we have the industrial leadership pillar. This is to maintain and develop the competitiveness of the EU industry and to develop new markets for the future. And it's probably focused on manufacturing technologies, ICT sector, nanomaterials, advanced materials, etc. And then we have the societal challenges pillar, where the 28 member states and the associated countries of Europe came together and decided what are the major challenges for European society. And there are 7 listed here, and health and well-being is the first on the list. So you'll hear me talking about societal challenge 1, which is the health and well-being. So there's €80 billion of funding across all of Horizon 2020 from 2014 till 2020. Health and Wellbeing has a budget of €7.5 billion over the entire period. The Commission releases its calls for funding, tells us what the funding opportunities are on a 2-year basis. And I'll, in the next few slides, I'll go through some of the funding opportunities that are open at the minute. There's also a little bit of funding for health in the Societal Challenge 2, looking at food security and its issues about obesity and sweeteners, etc. So I'll talk about that a little bit. So these are live links. If the slides will be distributed to everybody, and if you click on the blue text there, that'll bring you directly to the current work programme for health, demographic change and wellbeing. The specific objective of the health work programme is to improve the lifelong health and well-being of everybody, that's children, adults and older people, and to develop a high-quality, economically sustainable and innovative health and care system, and eventually developing opportunities for new jobs and growth. And the 2016-17 work programme is mainly looking at personalised medicine research and research for active and healthy ageing. But the Commission also aligns itself with the WHO definition of health, which is that health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. So hopefully this audience today, you will find some opportunity for research within that. So the 2016-17 work programme is going to cascade the funding through those 6 topics: understanding health, well-being and disease, preventing disease, treating and managing diseases, active ageing and self-management of disease, methods and data, and healthcare provision and integrated care. There is integration of social aspects across all of that, but mainly to develop solutions and products that are socially acceptable, that are directly applicable to people and communities in Europe, or that are marketable and cost effective. So it's not just research for research's sake, it is research to actually bring new therapies, new technologies, new systems to the community. And the social aspects that are within each of those areas include looking at human behaviour and choices for health, looking at lifestyles and well-being, economic analysis and business models, cultural aspects across Europe and variations across social groups. And within the health topics, a number of them are flagged for social aspects by the EC. So that means The Commission has sort of said that social sciences and humanities input is essential. It's an integral part of the expertise that's needed to properly address the issues. And those flagged proposals should contain a meaningful and integrated contribution from social sciences and humanities researchers. And importantly, the competition for this money is, as you can imagine, extremely high. It's very, very competitive. So the evaluation panels will include evaluators who are expert in social sciences and humanities, and they'll be checking to make sure that really the social input of the research being proposed for the social side is important and it's evaluated properly. I'm rushing through this a little bit, so I should have said already the work programme is released every 2 years. I have said that. The collaboration, it's collaborative research, so you need to have input from at least 3 member states. So this isn't something that can be done by Northern Ireland on its own. You need to collaborate across borders and work with different individuals, and as I'm discussing now, there's the multidisciplinary aspect to it as well. So looking at the topics for 2016, there are 6 health topics that I've listed here. There are also 4 connected health topics. I've split them into that because I'm the Northern Ireland contact point for health. There's also a Northern Ireland contact point for connected health. And there's a wee flyer in your pack. It's Dr. Shirley Davey is the contact person if you would like to find more information about connected health topics. All of the health topics that are open at the minute are looking for a full proposal, a 70-page proposal that would be submitted by the 13th of April this year. So the deadline's extremely close now. And I've flagged the ones now that are relevant for social sciences, humanities research, so where you guys might participate. First of all, PM04, as it's called, networking and optimising the use of population and patient cohorts at EU level. So this is looking at, you know, if you've got a cohort study in Northern Ireland for specific disease or specific health issue, you'd be wanting to link with a complementary cohort, maybe in another country, well, at least 2 other countries actually, work together and share the data and basically find opportunities to better inform each other, inform the communities, and use the data for better impact in the future for that particular disease. PM21, implementation research for scaling up evidence-based innovations in Europe and low and middle income countries. So again, that's using an innovation, applying an innovation that's been developed on a small regional scale, looking to see if that can be scaled up across Europe or in these low and middle income countries, which include maybe a lot of the African countries, countries in Asia, South America. The connected health topics I have listed, the closing date for most of these has already passed. PM14 is still open. It says EU-Japan cooperation on novel ICT robotics for active and healthy ageing, and that actually is another relevant topic for yourselves. And the closing date for that is the 12th of April this year. And PM09, new therapies for chronic diseases, the Commission has flagged that there should be at least a minor input of social sciences input to that. So just looking at PM04 in slightly more detail. As I said, it's looking at promoting cohorts, integration of cohorts on a specific disease, which is the choice of the researchers, working together, sharing the data, finding new ways to manipulate the data. So the social sciences input for that would be to develop policy strategies, to look at health economics and other research to address health inequalities, and where relevant, evidence for economic evaluation of the interventions should be included. And PM21, this is the scaling up of the innovative solution, of an intervention, The impact of this should be broad, addressing economic and social benefits for reducing inequalities again. And the research should identify the facilitators of and barriers to scaling up and as well as the differing social and health systems environments in Europe or the low and middle income countries. And the proposals should be multidisciplinary and look at gender aspects. So the topics for 2017, these are probably a better timeline for somebody looking at developing a project at the minute. These are a mixture of single stage and two-stage proposals. I've got the single stage ones on the right-hand side of the screen there, PM03 and PM11. So they will be submitted on 11th of April next year. And there are 4 two-stage topics. With the two-stage topics, you submit an outline, a short outline of your research proposal, which would be 10 pages. And the deadline for the stage 1 submission is 4th of October this year. And then if you're evaluated positively, you'll be invited to submit the full 70-page proposal by April of next year. And this is where we have PM07 on promoting mental health and well-being in the young, is an SSH relevant topic, as well as PM10, which is comparing the effectiveness of existing healthcare interventions in the adult population. And the connected health topics, they have a range of deadlines. They're all single stage topics. A range of deadlines from January, March and April of next year. We have PM15, personalised coaching for well-being and care of people as they age. The closing date for that is 31st of January next year. And PM17, which closes on 14th of March next year. It's personalised computer models and in silico systems for well-being. New therapies for rare diseases, again, a minor role for social sciences. So looking in a little bit more detail at PM07, it's about the mental health and well-being of young people. It really wants to promote population-based prevention strategies, basically to prevent mental illness in young people. The target group is people younger than 25 years old, or a subgroup of that population. And as you can read there, the social sciences input, the interventions should build on but may go beyond existing state-of-the-art knowledge on biological, psychological and social determinants of mental well-being. Those could be societal, cultural, work-life, lifestyle or epidemiological or economic and environmental perspectives. And PM10, it's looking at the effectiveness of existing healthcare interventions in the adult population. It's up to the researchers to choose what disease or health area they want to look at. It should have a high socioeconomic relevance, a high public health relevance, as I've said there. And the social sciences input would be looking at the costing of the interventions that are being compared, do a cost effectiveness analysis, and looking at gender and socioeconomic differentials in health and other factors that affect health equity. And as I said, there are some funding topics open in the Sustainable Food Security Work Programme, Healthy and Safe Foods and Diet for All. So there are 3 topics in there. The first one that I've listed, SFS 38, closed yesterday, so we'll discount that. But there's 2 that are open now for next year, how to tackle the childhood obesity epidemic and looking at sweeteners and sweetness enhancers. So there'll be a scope for social sciences input to that research. So as you saw, there were a list of 7 societal challenges listed. So we've gone through health and well-being and this sustainable food security. There's also a society's societal challenge and science with and for society. I had a look through those as well to see if there was anything for the healthcare field. There's nothing in society's work programme, but I did want to highlight that they have just launched a Horizon Prize for social innovation in Europe, and the topic is the challenge of the ageing population. So this isn't actually to fund research, but it will be a prize of £2 million cash to reward an innovator or a team who come up with the best solution to address challenges and opportunities of ageing and to improve the quality of life of senior citizens. There's not very much information apart from what I've displayed there at the minute, but if you click on the link, in the next couple of months, there should be more information on that prize if you feel like following up on it. And Science with and for Society, there's some research topics there looking at ethics of informed consent for novel treatments and looking at human rights perspectives as well. So what I've described so far, they're all research and innovation activities where you'll put in a joint proposal with a team across Europe to the European Commission. I also wanted to highlight that there's these funding opportunities as well. It's called Joint Programming Initiative. This is where national funding agencies have basically put some of their national funds together in a central pot to fund what they see as important societal challenges. So in this case, you're not putting your proposal into the European Commission, but you're submitting it to the Joint Secretariat, as it's called. Your funding will come to you. If somebody from Northern Ireland puts in a submission, your funding will come from the MRC, for example, or the ESRC, but you're still working collaboratively across Europe. So I thought it was important to highlight. So we have 4 JPIs that are appropriate for the health stakeholders in Northern Ireland. There's More Years, Better Lives, one looking at Alzheimer's and other neurodegenerative diseases. So there's no topics, no calls open for these from the UK funders at the minute. But keep an eye out, there'll be opportunities maybe before the end of the year. There's the JPI for Healthy Diet for a Healthy Life. So there's a call open at the minute looking at research for biomarkers in nutrition and health, and that will close in April of this year. And then there's the JPI on antimicrobial resistance. So they're looking for submissions by 21st of March. And again, you're working with at least 3 other organisations from at least 3 of the JPI countries. And then there's the Active and Assisted Living Programme, mainly for SMEs and industry. Living Well with Dementia is the topic that's open at the minute. And there's an info day in March in Brussels if you're interested in attending. So how to get involved in Horizon 2020 funding, it's a challenge. You might even put in an application which doesn't maybe get funded, but don't be put off, just keep trying. But how to get involved, how to find that network to submit a proposal with? Well, I'm written here, identify the key players in your field. So that might be by attending conferences or brokerage events in Europe, other European events, looking at publications, who are the main people that are publishing in that field. And then there are a number of internet-based sites that you can visit to try and inform yourself. So first of all, there's the Cordis website, which will detail successful projects. You can click on that web link and do a word search for a specific topic that you're interested in, and you might find people who have been funded in the past. See if you know any of them, try and make routes to engage with them, and propose yourself as a partner in their future proposal if they're putting one in. There are also a couple of partner search tools. There's Fit for Health, and in these partner search tools you can submit your own profile of your own organisation, or you can simply search to see what proposals are out there, who's looking for partners, and again make the contact with them to propose yourself as a potential partner. So we've Fit for Health, which is mostly for obviously the health topics. There's also Net for Society, which is actually mainly for social sciences and humanities researchers. So I think you guys could fit into either one of those, put your profile on either or in this case. The Enterprise Europe Network is a partner search facility that's managed locally by InvestNI. So they can do partner searches on your behalf. You can submit a profile to InvestNI to be advertised on the Enterprise Europe Network, and maybe people start to contact you as well. But also ask yourself how you can add value to a collaborative project. So what is your USP or your unique selling point? What's the trait of your organisation or your research that's novel, what that's interesting or unique. It might be the facilities that you have, it might be your expertise or the access to patients, or what aspects of the research are innovative and potentially interesting to partners in Europe. And I just wanted to finish off by saying, as an NICP, I aim to encourage participation in Horizon 2020 and engage with NI stakeholders. So please feel free to contact me at any time, or we'll talk at lunchtime if you've found something in the presentation today that you'd like more information on. I can link you with, or I can link myself and yourselves as necessary with the other national contact points in UK, Ireland and further afield. Link with EC officials and present workshops and partnering events. And if you visit the website there, h2020ni.com, you'll find a wee bit more information on the NICP network. And that's my contact details. Thank you very much for listening.